Welcome back. Let's have this discussion. Now, the George Mukhari Academic Hospital has suspended anaesthesia services to patients for tonight. It's believed there were delays in processing payments, which resulted in the decision of registrars and medical officers not to perform overtime duties. But for more on this, we are joined by the South African Medical Association CEO, Dr. Mzulungile, Nodikida, and DA Gauteng Health spokesperson, Jack Bloom. Gentlemen, a good evening to you. Thank you so much for joining us. I'm just trying to imagine, as we speak right now, if you are a patient at the George Mukhari Hospital desperately in need of surgery, what it looks like when you've told that that really can't happen because we don't have anybody to offer anesthesia services. Dr. Nodikida, do you want to go first and talk about what you make of the situation that's unfolding at the George Mukhari Hospital, the non-payment of staff? And I know that you can expand it because the South African Medical Association having raised the issue of non-payment at various institutions.
Yeah, no, thank you very much, Naleti. Really appreciate the opportunity, and good evening to you and to the viewers. Yes, it is really sad what is happening at the George Mukhari Hospital. And Naleti, just to put this into context, when the challenge with overtime started in various provinces, we then called meetings with the heads of departments of the various provinces. At that time, in early April, it was Gauteng and the Eastern Cape, with the Northern Cape as well. Luckily, we then, before the meeting, which was on the 7th of April, we had met with all the clinical heads of departments of the academic hospitals in Gauteng, and we invited them into that meeting with the HOD. We had a very good meeting with the HOD, I must say, and we had agreed that the changes that were being proposed in the various circulars were not to be implemented. Some of the changes were to reduce the hours of the doctors who are on call. So we then agreed at that meeting that that was not going to happen. And we didn't expect any problems in relation to the payment of committed overtime. We were really surprised on the 30th when most of the senior clinicians in Gauteng did not get paid. And luckily, we immediately sent out a survey that was already ready for us to get an idea of what was the extent of the problem. And I can report now that just over 620 of 628 doctors responded to our survey, and 536 are in Gauteng. We got responses in terms of the hospital distribution. There's 101 in George Mukhari, and we have 165 in Chris Hani Baragwanath. And in the East Rand area, we've got about 42. And because this was a national survey, so we did get some responses from other provinces as well. But just to update you what happened today, we met with the academic leaders again this morning. We have a task team in Gauteng that is looking specifically at this, made up of all of the clinical leaders from the various training institutions, VETS, Pretoria, and Medunsa. So what we then decided to do there was that because of the acute situation in George Mukhari, you would remember, Naledi, that at the moment, Tembisa Hospital's ED, the emergency department, is also closed because of that fire. Colleagues who were working in Steve Biko, because I must say that Steve Biko overtime was paid. So we don't have problems of payment in Steve Biko Academic. So they're not complaining, but when they paint the picture of the number of patients that they have to deal with, especially in the ED area, it's really overwhelming. So we've...
Yes, go ahead. I'll let you finish that thought, because I imagine that where you're going is that when you've got Steve Biko Academic Hospital, the doctors say that the payment issues aren't there, but they're complaining about the number of patients. And that's because they're having to pick up the slack from patients that would have gone to other facilities.
Yes, that's exactly that, Naledi. They are overwhelmed by the number of patients that they are seeing. And we've taken a decision to call an urgent meeting with the HOD of Gauteng again to say, let's solve the problem in George Mukhari. You cannot have that hospital closed. And he has agreed tentatively to meet with us in the afternoon of tomorrow after the run he says the systems would have, all the runs would have passed by then. So he would have a clear picture of who has been paid, who has not been paid.
Yeah, I must say this, because you've got a tentative agreement to meet with the HOD in the department. But obviously we reached out, as our team would have reached out to the Department of Health, the Gauteng Department of Health. And the response that we got from Mothaletale Modiba was, and I'm going to read it out, the department is not in a position to take part in the panel discussion at this stage, as we are currently engaging stakeholders, including a pending follow-up meeting with the South African Medical Association, yourselves, on this matter internally, and do not want to run a parallel process, as this will further undermine the engagement process. Jack, I'll let you come in here, because, I mean, as opposition, you've been very outspoken around the state of healthcare in the province. And for years, one of the things that you've been raising is the management of finances within the Department of Health. You listen to some of the data that we're getting from the doctor. What do you make of where we are right now, when patients tonight at George Mukhari Academic Hospital having no access to anaesthesia services?
It's of great concern because, of course, it's having knock-on effects. The emergency case being dealt with at Steve Biko, and obviously the doctors are overwhelmed there. And I saw a notice this afternoon that doctors who haven't been paid overtime in the Kuruleni are also threatening not to work at all. So this is actually spreading, and it should have been a crisis that was easily preventable, because there have been warning signs. The department is giving a poor excuse that it's the new financial year and they're getting their systems in place. But, you know, frankly, paying your doctors on time should be, basic efficiency. But we don't seem to have that with the Gauteng Health Department. And of course, there's the broader issue where they're cutting down on commuted overtime in general. And of course, the effect on patients can be very severe, because we're short-staffed in the first place. We need doctors to work overtime, emergencies, over weekends, at night, and that's when we won't have them. So there's a whole host of issues that haven't been dealt with by the Gauteng Health Department, which faces a real financial crisis, actually, and it's been an ongoing one for many, many years. And, always towards the end of the financial year and the beginning of the financial year, these problems seem to become worse. They've got accruals. That's basically, money still owing to various countries of various companies and suppliers of billions of rands. So every year they start the new financial year and they have to pay off the debts of the past financial year. And we can't keep going on like this. I mean, we haven't seen the type of intervention that is necessary to get this department on the right footing. The DA has been calling for some time now for the health MEC and the head of department to actually be fired, quite frankly, because there's a whole host of scandals. The latest, of course, is that there was a devastating court ruling against the department that they weren't meeting their constitutional duties in treating cancer patients. Now they're appealing this judgment. But we have a premier of this province. He should know that the Gauteng Health Department is scandal-driven and not showing any real signs of being fixed. And you need to take drastic action. You need to change the people at the top. So I'm very distressed, because the effect on patients is terrible. It's a department in strain, and I don't blame doctors who are fed up, and this boycott could actually spread, unfortunately. But if you're not being paid, why should doctors work?
So, Dr. Nodikida, apologies for butchering your name there. So this tentative meeting now takes place with the HOD in the Department of Health with the South African Medical Association. What is it that you expect to hear that says that there will be some sort of resolution? Because a meeting certainly can happen, but you already know that the Department of Health is structurally looking at cutting payments for overtime, and that is going to discourage so many of the doctors that we desperately need. What can come out of this meeting that says we can move the needle?
So SAMA, Naledi, wants doctors to be paid for work that they've done. That's the outcome we're looking for the meeting. We just want doctors to be paid for the work that they've done. And we also want to make sure that doctors are there for the health of the nation. So that's basically what we expect there. But again, I think, Naledi, it's important to put this thing into context again. The committed overtime, which is the after hours time that doctors work and teach, because it's also important that this time is not just for service, it's also a process of teaching for undergrad and postgrad medical graduate. So that time this is one of the policies that the national minister came out and said it needs to be reviewed. So it's about 3 of the health human resources policies that are being reviewed. So the minister has appointed a ministerial advisory committee, which of course we have our own issues with, but we are willing to work and make our own submissions there. Our understanding of this committed overtime is it is outdated, and it also false balloons what doctors earn. So we will make those submissions there, but we think that provinces, including Gauteng, in fact all of them, they should now stop any of the changes that they intended to make on these policies until that work of the MAC and of course our own submissions are made. So that's one of the things that we want to engage the HOD with tomorrow, just to make sure that so that their systems are not disturbed, because we think that some of the changes that they were trying to make in relation to these policies might have disrupted the way in which they were paying doctors. So we just want them to take a step back and just await the process of the MAC to be completed.
Yeah, of course, we're getting closer and closer, Jack, to really seeing what the finance minister puts forward in Budget 3.0. Is there something that we can hear from the finance minister that at least resolves some of the challenges that we're seeing here in Gauteng in having the budgets and certainly seeing them reach the pockets of healthcare workers?
The Gauteng Health Department has already tabled their budgets. It's just over 67 billion rand, which is actually a huge amount of money. If they spent it properly without waste and inefficiency and corruption, because there's a huge amount of corruption, I think they could do a lot of good quality healthcare with it. But unfortunately, it's a dysfunctional department for a very long time. Look, obviously there's the VAT increase isn't going through, so I don't know if there's going to be any changes to what the minister's already announced. The minister actually said there was going to be extra money to hire more staff, but that is the. I'm actually asking now in Gauteng province whether the province is going to be using the extra money to hire extra staff, because it appears that they're not using the extra money to hire unemployed doctors, because that's the scandal we have, is that we train doctors and many of them are unemployed. So, I think the financial situation is largely set. The Gauteng Health Department's problem is that they've just got massive arrears to pay off, and that's the crisis that they're in. At the moment, there's frozen posts, and they've also frozen the purchase of new medical equipment. This is having huge effects. So, I feel for doctors. It's an unfair labor practice. It's unilateral change in their conditions of employment. I mean, many doctors, it's more than 30% of their take-home pay, and now it's threatened with the cut in overtime. They won't have that anymore. So how do you end up doing such a drastic change without the necessary consultation? And as Sama has made the point, is that the whole overtime situation is going to be reviewed. So it's very unsatisfactory, and unfortunately patients are the ones who suffer because of it.
All right. Well, we're going to have to leave it there, gentlemen. And unfortunately, a conversation that needs to happen more and more, because you've got patients that are desperate to receive treatment and doctors that just want to be paid their fair amount. Thank you so much for speaking to us, though. Jack Bloom, DA Gauteng Health spokesperson, and Dr. Mzulungile Nodikida speaking to us there.